Come along with us and we'll walk you through a PICC line dressing change. First, you want to begin by cleaning your working area. Once that's complete, now we can gather our supplies that we will need. Now we will perform good hand hygiene, scrubbing vigorously for at least 20 seconds. Once your hands are dry, you can now put on your mask and gloves. Then we can begin to open our sterile packages. At the end of our dressing change, we will also be changing the needleless adapters on the end of the lumen. So at this time, we're going to go ahead and prepare a needleless adapter with a flush and have it ready to go. Our PICC is a single lumen, so we'll only need one. Now we're just going to take a piece of tape and we're going to secure the end of our PICC line down to the patient's arm. That way it's good and secure and we don't risk getting it caught during the dressing change and possibly pulling the PICC line out. Once your PICC line is good and secure, you can go ahead and start to remove the dressing from the patient's arm. If you have any issues removing the dressing, you can use an alcohol swab or a chlorhexidine prep to scrub the edges of the dressing. That way it'll make removal easier for you and your patient. It's really important here to take your time loosening this dressing up. That way we don't cause skin tears for our patients. As the dressing begins to come loose, you can roll it up towards the patient's armpit, ensuring that you do not roll it past the stat lock. Now that the stat lock is easily accessible, we're going to remove our dirty gloves and perform hand hygiene again. Once your hands are good and dry, you can go ahead and prepare your sterile gloves and don them. Once you have placed your sterile gloves on, then you can begin to remove the inner content from your central line dressing change kit. You want to begin first by removing the sterile drape and laying it out on your work area. That way you can maintain a sterile working field to set the rest of your supplies on. You can organize these supplies however you wish, and then you're going to take your chlorhexidine scrub and we're going to scrub the stat lock so that we can begin to loosen it and get it off. It does take a little time and patience to get these loose, but we want to ensure that we're not causing any skin tears or damage to the patient's skin. Once the stat lock is good and loose, then you can go ahead and unclamp the PICC line from the stat lock itself and remove the stat lock away from the patient's arm. Once your stat lock is removed, you want to maintain your grip on the PICC line around the hub area. Then you can continue to roll the dressing up towards the patient's armpit until you're able to completely free it from the patient's arm. Now you will remove your sterile gloves, perform hand hygiene once again, and you will don on your second pair of sterile gloves. Now that you have your new pair of sterile gloves on, we're going to grab a new CHG, so this would be the second one that we have, and we're going to scrub the area. While doing this, we want to ensure that we maintain a good grip on the PICC line so that it doesn't become dislodged. You want to be scrubbing in a back and forth direction for at least 30 seconds. Once you've completed scrubbing, you want to allow the area to dry for at least 2 minutes. Once the area is good and dry, we're going to take our skin prep and we're going to just work our way around the site in which the tegaderm would lay. Once your skin prep is dry, you can now take your stat lock and you can slide it underneath the hub. You want to be very careful while doing this, ensuring that we do not dislodge the PICC from the patient's arm. Once you have the wings of the PICC lined up with the stat lock appropriately, you can go ahead and clamp down the wings of the stat lock and you can remove the paper backing and then secure it firmly to the patient's arm. Now we will place the BioPatch directly over the insertion site, and you want the slit to be facing down towards the stat lock. Doing so will ensure that with the next dressing change it will be easily removed and it will not dislodge the PICC line. Now that our BioPatch is in place, we will remove the backing from our tegaderm and place the tegaderm directly over the insertion site and the stat lock so that they are visible through the clear window. Ensure that the tegaderm is firmly secured to the patient's skin. Then you can go ahead and remove the extra paper around the edge. Now you will remove the bottom part of the dressing from the paper that you just removed from the tegaderm. Now that you have the paper part of the dressing removed, you can take the other two parts of the dressing, and at this point you can untape the PICC line from the patient's arm and secure the rest of the dressing in place. And then we want to remember and make sure that we date and initial our dressings. Now we're going to change our needleless adapter. We're going to take an alcohol swab and we're going to remove the needleless adapter that's currently in place on the end of the lumen. Then we're going to scrub with the alcohol for 15 seconds. Once we're done scrubbing, then we're going to go ahead and take the flush and needleless adapter that we already have prepped and ready to go. You will then take the flush and the adapters out of their package and then you can go ahead and screw the needleless connector onto the end of the lumen. And this is a perfect time to go ahead and ensure that you have good blood return to your PICC line, which you always want. If you don't have blood return, there is an issue. And then at that point in time, you would want to go ahead and flush your line as well. We're using a mannequin, so we're not going to be demonstrating the flushing at this point in time, but you would use a pulsating flush, and then you would also simultaneously clamp to create positive pressure. The positive pressure prevents blood from backflowing into the lumens and clotting off while not in use. Then we want to check our arm circumference at the end and document it as well, and that is a dressing change for a PICC line.